We could have never foreseen the impact of halting screening for cancer, specifically colorectal cancer. And so we see a tremendous backlog.
Welcome to the first episode of For the Health of It. I'm your host, Bill Evans. In this series, we're going to bring together scientists, luminaries, medical and public health experts to discuss some of the thorniest challenges in healthcare today. We're excited to have Anjee Davis, President, Fight CRC, with us to talk about the impact that COVID is having on the diagnosis and treatment of colorectal cancer. Welcome, Anjee.
Hi, Bill. Thank you so much for having me. I appreciate being the first guest on your new show. Fight Colorectal Cancer is the leading advocacy organization focused on pushing healthcare policy, helping educate patients, raising awareness, and funding and supporting research. We're really excited about our partnership with Komodo because ultimately we want to be able to focus our efforts and provide highest and best use of information for our patients.
So during the height of the pandemic, especially in the spring, there was a major drop-off in colorectal screenings. I believe by mid-April, the number had dropped in terms of colonoscopies and biopsies by nearly 90%. Can you talk a little bit about why there was such a steep drop-off earlier this year?
2020 has been a challenging year. I think we could have never expected the global pandemic to have impacted screening as it did. But March was Colorectal Cancer Awareness Month. We were in sort of the peak of raising awareness around colorectal cancer screening. When COVID hit, elective procedures were halted and colorectal cancer screening fell under the list of elective procedures. And I think that we could have never foreseen the impact of halting screening for cancer, specifically colorectal cancer. And so we see a tremendous backlog of screenings and a healthcare community that's trying to keep up with, a pandemic and the need to maintain healthcare.
So I'm wondering if you could talk a little bit about the impact specifically it had on the patient community. What are the downstream effects and why is this so concerning?
In April, we partnered with Komodo to really answer that question. I think we were really concerned as the pandemic progressed and we continued to be in a lockdown. We really deal with a tremendous amount of immunocompromised families, caregivers, and children. And so we surveyed over 200 patients to see, how are you feeling? What are you going through? Over 70% of those had anxiety about rescheduling of regular appointments with their oncologists. Surgical procedures were delayed. Questions around clinical trials, whether they were open or not open, were very concerning for our stage 4 colorectal cancer patients. Radiation therapy, chemotherapy, all these things are already very difficult for patients. Were upended by having to work with nurse navigators and their healthcare teams to say, can I adjust to telehealth? When do I go in? Should I be afraid of the impact of COVID and my vulnerability to COVID? And what can I do to make sure that I'm taking the best care of myself? And I think there was a lot of anxiety within our community due to all the variabilities that were introduced due to COVID.
So there was a rebound in procedures, but we're in the midst of a second wave. What are you seeing that might be different this time around, either from lessons learned from the last slowdown in testing or just differences that have occurred because of where we are in the year?
Our healthcare teams are getting smarter about how to triage patients. They're being able to prepare for the second wave in a way that they weren't able to in the first wave. I think patients are starting to get comfortable with the idea of wearing a mask, sanitation, making sure that they are scheduling and proactively scheduling appointments, working with new opportunities around telehealth and making sure that those are reimbursable. So you're going to hear a lot from the advocacy community to not delay care, to not be afraid, to reduce that anxiety that patients have been feeling since March.
Well, Anjee, thanks so much for joining us today. It was great to hear your wisdom and your insights about what's going on in the community. To learn more about Fight CRC, you can visit Anjee's website at fightcrc.org. And to learn more about the effects that COVID is having on the healthcare marketplace, you can visit komodohealth.com/insights. Be sure to follow Komodo Health on LinkedIn or Twitter for updates on future episodes. See you next time.